I had a disc fusion in my neck when a long time ago, in 2001, and it left me unable to move my neck and shoulders without pain, and eventually it left me without being able to walk without pain and pretty much move anything without pain. So I went to a rheumatologist, and he diagnosed me with rheumatoid arthritis and told me that within 3 months I would be in a wheelchair if I didn't accept the drug therapy. So I did that, and it was a low-level chemotherapy with methotrexate and Enbrel and some strong anti-inflammatories, prednisone, and a few other things. And he said people live on this very well and without pain for at least 10 years without problems. So in 2 years, my liver failed. And at that point, they had wanted to remove the bones in my wrists. And I had said I couldn't do it. And my liver continued to get bad. And they told me that I would need more drug therapy of a different type and possibly to be on the transplant list. So I pretty much gave up. And then friends found out about the clinic and came and pretty much brought me here every week for a year. I had been on high-level pain medications, Vicodin and several others, and I was pretty much addicted to those when I came here. And so I had to wean myself off of those, but at the same time I was starting IV therapy, and it seemed easier for me to get off of the pain medication, and all the prednisone was the hardest. Getting off of prednisone was a really long, drawn-out process, but worth it. So after a year of coming here, I still just thought I had RA, and I was still trying to dig out of my big hole of sickness. And so the doctor that was traveling through, again, it was at a different time, had a different blood test because they hadn't detected Lyme in my dark field microscope test. So they did an oxygen-starved blood test, and they saw Lyme's in there. And so that's what led to the having the x-ray looked at and finding that there was a problem with that in the jawbone and correcting it. When they looked at my x-rays of my jaws, they could see that there were nerves and all kinds of decay and problems in there that he recognized as something he'd seen before. So I just recently finished having the surgery where they clean all of the bone out and make a new start so that everything can grow back healthy. But now after that surgery, I seem to not have my RA pain anymore, and it just vanished. I thought it was the pain medication, but after the pain medication is gone, I still don't have any pain. And along with that and all of the injection therapy and all of the IVs and everything I've had, I think, built up to just this last culmination of the jaw surgery making things right. So I pretty much figured that I had Lyme's disease first, and that the diagnosis of RA is just the culmination of so many years of having Lyme's disease, and that it's all led me to do all of the IVs and correct all of the problems that I've needed to correct. And I think I'm pretty much at the end of treatment. To me, I feel healthy and well and pain-free. So.
And no meds?
No meds, none. And I just celebrated my 2nd year anniversary in August. So 2 years I've been coming, and I'm doing great.